Hi there, welcome in. I'm gonna be your doctor today. I'm Dr. Mint. So it sounds like you were coming in because you were complaining of some pelvic abdominal pain. Okay, yeah, why don't you tell me a little bit about that? So it started maybe a few weeks ago? Okay, and you've noticed some discharge from your penis? Okay, what color discharge? Is it whitish, yellowish, greenish? Okay. So, from that little bit of information that you've given me so far, it sounds like you're experiencing an STD, maybe something like gonorrhea. Have you been having any unprotected sex recently? Probably a couple days before your symptoms started? Okay. Yeah, so you've been having sex without a condom. All right, so that is going to definitely increase your risk greatly of coming into contact with someone else who has an STD and then contracting that as well. Now, usually men are asymptomatic, meaning that they don't typically show symptoms, especially for STDs, but you must be one of the lucky few, huh? So, I think we are going to move into doing a urine test just so I can rule out which STD it is and get a confirmation before we prescribe any antibiotics or anything like that. So we will do a physical examination today as well as the urine sample because I am going to want to see that discharge, probably take a sample of that as well, and then just see if there's any kind of lesions or anything. And you've said that area is pretty painful, right? Okay, yeah, so we're going to check that out. Have you experienced any burning upon urination? And have you noticed any sores or rashes on your genital area? Maybe thighs or kind of upper pubic bone, like lower stomach? Okay, maybe a little rash. Has anything been itchy? Okay. Yeah, that's very typical of an STD. Do you do any other kind of risky behaviors? Do you do, let's see, maybe tattoos from not reputable places? Have you done any drugs, especially intravenous drugs? Okay. Yeah, that's good. But again, so this is probably just an STD and again from unprotected sex. So I would definitely recommend in the future that you and your partners get tested if you're going to decide not to use a condom, but you should probably just use condoms. It definitely helps protect you and your partner as well. And things with prolonged STDs, especially for instance, gonorrhea, which is what I am suspecting that you have, it could lead to reproductive issues for you further down the line. You can even get some things like pelvic inflammatory, where it is chronic and you could experience chronic pelvic pain, which is no fun, obviously. So it's definitely very important to take care of your own health and be aware of those things. So I'm just going to have you go use the restroom in there. There are the vials in there, which I'll have you urinate, do your sample. And you're going to write down your name and date of birth in there, cap the sample. There'll be a shelf in there just to place it on. The nurse will come and grab it once we're done with this visit. And then we will have you get dressed down into a gown, since I am going to be checking your pelvic region. You can keep shirt on, etc. underneath it, but I do need you to remove your pants and underwear. Okay, sound great? I'm gonna get masked and gloved up and we will just get to the exam once you are ready, okay? All right. Get my hands nice and sanitized. Are you ready to begin the examination? Yeah, so you can just stay standing or seated if you prefer. Standing? Okay. Perfect. So first, I'm just gonna have you move the gown up so I can just begin examining the region just visually. I'm gonna use my little pen light here, and we're just gonna take a look, okay? All right. So please lift your gown for me. Thank you. Okay. Yeah, I am right off the bat noticing some redness. Looks, yeah, kind of like a rash down there. Is it rather painful? Okay, on a scale of like 1 to 10, 10 being you're almost gonna pass out for how painful this is. Okay. All right. Yeah. No, they are definitely uncomfortable. Let's see. It does look like you have a little bit of a lesion on the side, the shaft of your penis right there. Yeah, there on your right. Okay. Yeah, that would be a typical sign of gonorrhea as well. And it does look like I'm seeing an area of like skin tags that you have on your thigh, and those look kind of red too. Are those bothering you? Are they causing like discomfort when you walk? I know the movement friction can be quite painful, and those especially as we're moving into the summer months with like chafing and things like that. Yeah. Okay, yeah, I will write you a recommendation to go to a dermatologist, and they will be able to figure out how to get rid of those the best way. Sometimes it could be just a removal or freezing. Yeah, so I will get you a referral over to our dermatologist side of the clinic. Okay. Yeah, so it looks like things are looking rather infected and inflamed. Not really what we're hoping for, but we are going to make you feel better as soon as we can, okay? So next I'm going to start with palpating. I'm going to start kind of in your lower abdomen area, because big things with infections, they can start moving into your kidneys, and we'll be able to tell if you're starting to feel pain higher up. Okay, so I'm going to start here. I'm going to be on like your lower abdomen, and I'm just going to be patting, okay? And you let me know if there's any pain. It shouldn't be, but it's starting to look like your infection's a little more further along than I would like, so that you might have some pain, so just let me know, okay? Is that pretty tender? Okay, yeah. All right, yeah, and there too. Okay, yeah, so I'm gonna make a note of that. We're definitely gonna be getting you on an antibiotic pretty quickly once the results from your urine test come in. And I checked your chart. It doesn't look like you're allergic to any medicines. Is that still up to date, current? Okay, good. So yeah, once those results come in of the test, then we will get you on the specific antibiotic that we need to. Yeah, okay, yeah, it's definitely look like the infection is progressing. All right, so now I'm going to be looking at your penis. I'm going to be palpating there, where I am going to be very gentle around the lesion. Obviously, it's an open sore. It's going to hurt. And I think we will be taking some swabs today, okay? Again, since you mentioned that you've noticed some discharge, I will be swabbing some of that discharge as well, just in case. All right, so I'm going to start with the palpation. So I am going to be handling your penis. Are you okay? Are you comfortable with that right now? Okay. And I'm going to be as gentle as I can be. Okay. And there's some tenderness there. Okay. Yeah, I'm noticing some redness along here. And it's also looking like, are you having any pain in your scrotum area? It's looking like one of the testes is kind of enlarged. That does happen during gonorrhea. It's usually a very rare symptom of it, but it does look like you are rather inflamed. It is kind of painful. Okay, yeah. It's not much. It's not much. So it doesn't look like it's doing anything like irreversible damage is what I'm saying. Basically, it looks like it's just starting to move into your testes. So we definitely need to be acting pretty quickly. So I'm really glad that you came in today to get checked out. Okay. Yeah. All right. Now I'm going to go up on the top of your shaft and the base of it. Okay. And again, we're just going to be palpating down your penis from the base to the head, the glands. Okay. And a little painful there. Okay, sorry about that. Okay. All right. So now I'm going to grab this. And we're just going to do some swabbing. One moment. Let me get this ready. Okay. Put this container. Okay, let me just, I'm gonna kind of swipe along that lesion. I know this is gonna be a little painful. I'm so sorry. Okay. Get that mixed around in that vial. Okay. Now I'm going to do the swab again. I'm just gonna kind of hold the head of your penis open so that your urethra's open, because yeah, I am seeing some discharge, so we're gonna swab that. Okay. Okay, we'll get a vial for that real quick. And just mix that in the solution. And we'll get these sent to the lab as well. Okay, good. Oh, good. It looks like one of the nurses grabbed your vial of urine. So let me just check in your chart real quick. Okay. Yeah, so those tests have come back and they are conclusive for gonorrhea. So I'm going to write you a prescription for a week-long antibiotic that I want you to start taking as soon as you go pick it up, okay? So I'm going to have you pick it up today, and you're going to be taking 2 pills, and I want you to be taking them with food because they can kind of upset your stomach, okay? So with food, you're going to take one in the morning and one in the evening, but you're going to start taking one today, and this will just count for your evening pill, okay? And then just finish them out till the end of the week. I want you to take all of them. Don't stop if you start feeling better. And then other things important to note, please don't drink any alcohol when you are on these. And then please still refrain from unprotected sex until after you've finished the course of antibiotics. And I think it's very important that either you or you can give us the names of the people that you've been in contact sexually so that we can get them tested and treated as well if need be. Okay, sound good? All right, so let me put this in the computer. Okay, yeah, and is your pharmacy still the same? Okay, perfect. Awesome. All right, I have sent the prescription over to your pharmacy. It usually takes a couple of hours for them to have it ready, and they should be calling you to let you know to pick up your prescription, okay? Good. So it was a pleasure getting to check you today. And it looks like we are going to get this treated for you as soon as we possibly can. But do let me know if you are not seeing any changes in about a week. Once the antibiotics has run its course, you'll probably start to feel, a little better in the next couple of days. You'll probably notice the burning sensation subside when you're using the restroom, and the itchiness, the rash should start to go down fairly quickly. But like I've said, even though those symptoms are leaving, that you still need to finish that course of antibiotics, okay? Yeah, that is very important. Do you have any other questions for me? No? Okay. And again, if any questions come up, anything like that, our nursing line is available 24/7, so you can call and either speak to a nurse or they can get a message to me and then I will call you. Okay? Perfect. All right. So thank you so much for coming in. I hope this, was a good visit for you and we've gotten all your questions taken care of and we're going to get you feeling a lot better as soon as we can. Yeah. Oh, so yeah, if you would like, we can definitely come in and check you another time in case you're having any prolonged issues, but I think we caught the gonorrhea pretty early enough, is what I would say. Early enough. Yeah. That I don't think you're going to have any lasting effects from it, okay? Yeah. But definitely, yeah, you should not wait this long next time. Okay. Thank you for coming in. Remember to go pick up your medicine. Bye-bye.